Let's talk about medical trauma and some of the trauma I've experienced and how I've kind of coped with that. So medical trauma is exactly what it sounds like. It's trauma that somebody has experienced from a procedure, an illness, something that has happened to them medically that has traumatized them. And unfortunately, this is common for a lot of people, especially chronic illness patients, because we go through so many medical procedures that there are oftentimes that we get traumatized from that, especially if we're younger and was diagnosed younger and started going through all of this. There's a lot of trauma that can come from all of these things. And for me personally, I remember there's been a couple of things. So when I was a little younger, I had a flex sigmoidoscopy, which is basically it's kind of like a partial colonoscopy, but they do it awake. And I was pretty young. I mean, I was 19, I think, and I was not prepared for that. They do it awake. It was very painful. I remember yanking the doctor's hand. It was a very traumatizing experience. And I've had times where I was getting stitches and the numbness wore off, or they started and they realized that they forgot to numb me. These are the little things that build up that lead to medical trauma in patients. And ways that I've dealt with it, I've had therapy for it, and I've had a lot of conversations. But I mean, there are a lot of times where I just kind of retreated away from seeing physicians for a little bit, just because I was so traumatized. So it's just very important to realize this. I think from a physician standpoint, from like a healthcare provider standpoint, that these things can be traumatizing, and that from our standpoint, from a patient standpoint, that's very important to take care of that, to seek help, get therapy if needed, so that we can overcome that. Because unfortunately, with chronic illness, we have to continue to seek care. But if you've ever experienced chronic illness trauma, let me know. I'd love to talk to you about it.